Hey, welcome. Thank you so much for joining us for the FFPSA webinar. Today, we're going to talk about just an update on the Federal Family First Prevention Services Act and give an overview of the DFPS FFPSA strategic plan on September 1st, 2020. Our presenters today are Sasha Rasco, the Associate Commissioner for Prevention and Early Intervention, and Deneen Dryden, the Associate Commissioner for Child Protective Services. Just to go over a few housekeeping items before we get started, you can submit questions during the webinar through the question tab on the control panel, and we'll do our best to answer any questions. If you have questions after the webinar or we can't get to them, there will be a website on at the end of the presentation where you can submit questions at any time to the FFPSA mailbox. We will also archive this webinar on the DFPS FFPSA webpage for those who aren't able to participate today. And now I'm going to turn it over to Deneen Dryden to get us started.
As Heather stated, we'll provide a brief overview of FFPSA and then discuss the strategic plan DFPS published on September 1st. We will leave time at the end of the presentation to answer questions received through the chat box. The webinar is being recorded and it will be made available on the DFPS public website. FFPSA was signed into law as a part of a bipartisan budget act on February 9th, 2018. This law, among other changes, restructured child welfare funding, particularly Title 4E and Title 4B of the Social Security Act, which Texas uses to pay for the care of children in foster care and their families. FFPSA targets improved services and outcomes for four main populations: children placed in congregate care, kinship caregivers and the children they care for, parents who struggle with substance abuse in their children, and children who are at imminent risk as defined by Texas for entering foster care. The prevention services encouraged under FFPSA are meant to be delivered to families involved in the child welfare system that are at a significantly higher risk than the services provided by the Department's Prevention and Early Intervention Division, which are delivered by community providers to families with the hope of diverting them from any type of involvement in the child welfare system. FFPSA aims to elevate the quality of specific types of prevention services provided to families with children at risk of entering foster care. It also aims to encourage and support kin placement, support pregnant and parenting foster care youth, decrease the use of and spent time in congregate care settings, and allow children to be placed with their parents in substance abuse treatment facilities. November 2018, Texas notified the Federal Administration for Children and Families that it intended to delay implementation of certain provisions of FFPSA until September 2021. The delay allowed Texas to gain more clarity on the requirements of FFPSA as the federal government continues to provide additional guidance on implementation to states, engage stakeholders, examine the resources needed to enhance evidence-based prevention services, and determine the best path forward for the children and families of Texas. During the 86th legislative session, two bills passed that required DFPS to complete a strategic plan. Senate Bill 355 requires DFPS to submit a strategic plan for implementation of the prevention services provisions of FFPSA. Senate Bill 781 requires DFPS to submit an analysis and recommendations associated with the placement provisions of FFPSA. These two strategic plans were combined and submitted to the legislature on September 1st, 2020. The strategic plan provides information on the existing Texas landscape for the programs affected by FFPSA and the provisions of this important federal legislation and presents opportunities for its implementation in Texas. DFPS will be awaiting legislative direction during the 87th legislative session. FFPSA includes 5 required provisions. Texas is complying or has a plan to comply with each of the following. Creation of an interstate compact on the placement of children, National Electronic Interstate Compact Enterprise system to quickly and securely exchange data and documents for children placed across state lines. This system must be operational by 2027, but Texas anticipates compliance by 2023 as work is already underway. Creation of a statewide fatality prevention plan to prevent abuse and neglect fatalities, and Texas is complying with the federal guidelines. Establishment of protocols to prevent children from being inappropriately diagnosed and to ensure appropriate placement. Texas is complying with federal guidelines. Implementation of procedures for providers to conduct abuse and neglect registry and criminal records checks, including fingerprint-based background checks. Texas is also complying with the federal guidelines. Compliance with proposed federal model licensing standards. Texas submitted a Title IV state plan amendment for approval to the Federal Administration for Children and Families, addressing which of Texas's standards are consistent with the model licensing standards, which standards deviate from the model standards, including the reason for the deviation, and whether Texas will update the state standards. ACF informed Texas that it had approved the revised Title IV state plan addressing the model licensing standards, and HHSC will be updating the minimum standard administrative rules as noted in DFPS Title IV state plan amendment.
Good morning. This is Sasha Rasco. I'm going to talk a little bit about the option for funding evidence-based prevention services, which is one of the transformational pieces of the Family First Prevention Services Act, the allowance to spend Title IV dollars on services that might prevent the entry of foster care by bolstering the mental health, substance abuse, treatment needs, or parenting skills of families. So FFPSA would allow a 50% match of state investment, so a dollar-for-dollar match of state to 4E funds for services, evidence-based prevention services for families who the state determines to be at imminent risk of entering the foster care system, including children whose adoption or guardianship is at risk of disruption or dissolution, as well as pregnant and parenting foster youth. The federal administration, or the Administration of Children, Youth, and Families, is maintaining a clearinghouse. Those evidence-based programs do have to meet their criteria of either being well supported, or promising in order to receive the 4E funding. We're not going to go through the entire list, but more programs are continually approved to date. The programs listed on the next 3 slides are those programs eligible for 4E funds. Under mental health, you'll see things that I think are already available in many organizations and communities throughout Texas, things like child parent psychotherapy, incredible years, triple P, multidimensional family therapy supported. But these are the types of models already allowed under FFPSA. In the substance abuse, there are fewer models already cleared by the FFPSA clearinghouse, but there are some, and we're hoping that list will grow. In what they call in-home parenting or parenting skills and supports, are several home visiting models already funded throughout Texas, and such as Parents as Teachers and Safe Care, as well as some other models of building parenting skills that the state has some experience with, like home builders, and again, multidimensional family therapy. And the last category of programs are those that might help navigate kinship providers to services. There's not yet an approved program for kinship navigator services, but we are piloting some efforts, and we hope that others in other states might come forward with the level of evidence that that the administration is looking for to meet criteria for approval.
Looking now at FFPSA optional provisions, FFPSA does not disallow any placements currently authorized and utilized in Texas. It does, however, limit and change the placement types eligible for reimbursement of Title IV-E funding. Texas will no longer be able to claim Title IV-E foster care maintenance payments for IV-E eligible children in some congregate care settings. Effective September 29, 2021, Title IV-E reimbursement is limited to 2 weeks in those settings. The funding limitations of FFPSA will apply once a child is moved to a new placement after September 29, 2021. As of the last day of fiscal year 2019, 3,396 children were in a non-QRTP congregate care setting, and approximately 42% of the care days provided to these children was IV-E eligible. The loss of IV-E eligibility for these placements is projected to cost approximately $26 million per year. The placement types eligible for consideration of Title IV-E funding under FFPSA are identified below: family foster homes, providers specializing in providing prenatal, postpartum, or parenting support for youth, supervised settings for young adults over the age of 18 who are living independently, residential care for children and youth who are found to be or at risk of being sex trafficking victims. And the last one is QRTP. Because of the change in allowable IV-E placements, impact will need to be updated prior to September 29, 2021. The necessary changes will be complex in nature, and DFPS has already begun prioritization of this project. In order for a provider to have a program that is considered to be a QRTP, the program must meet all prescribed criteria as set out in FFPSA. These include a trauma-informed treatment model, being registered or licensed nursing staff and other clinical staff who are available 24 hours a day, 7 days a week, and on-site during business hours. A program that facilitates participation of family members in the child's treatment program. A program that facilitates outreach to the family members of the child, including siblings, and involves documenting and maintaining contact information for any known biological family and fictive kin of the child. Documentation demonstrating how the family members were integrated into the treatment process, including post-discharge, and how sibling connections are maintained. Also, a program that provides discharge planning and family-based aftercare for at least 6 months post-discharge. Accreditation by one of the 3 listing accrediting bodies, Council of Accreditation, Joint Commission, or CAR, or any independent not-for-profit accrediting organization as approved by ACF.
As you can see, this is a wide-ranging bill that is also a lot about complex financing, and placements in substance abuse treatment facilities is another area allowed for IV-E funding under FFPSA. Texas may claim Title IV-E reimbursement for foster care maintenance expenses for up to 12 months for a child in DFPS conservatorship who is placed with a parent in a residential family-based treatment facility for substance abuse without regard to the child's 4E eligibility. As of July 2020, Texas has 10 residential providers that serve all Texas parents, not just those in the child welfare system, with substance abuse disorders, while allowing their children to remain in care. Under kinship navigation, this allows also for the provision of services to families not involved in child welfare. It allows for the benefits and services, including information, referrals, follow-up services, counseling, and other assistance to kinship providers, regardless of whether they are involved or the children they are caring for or their kin are involved in child welfare. There are currently no approved kinship navigator programs, as we already mentioned, so no option right now to draw down federal funds, but it's an area where obviously DFPS is already funding services and will keep an eye out for that opportunity. Another, a later development after the adoption of the Family First Prevention Services Act, the federal government created a Family First Transition Act and provided funding, and in 2019 signed into law the act, which allows or pays for implementation efforts that are one-time and cost. By providing states transition funding, the federal legislature recognized that there were upfront investments that states would need to make to sort of help with this transformation of the child welfare system, and the funding must be used to advance the goals of FFPSA. The funding is not eligible for additional federal match as it is federal dollars, and DFPS has received $50,265,902 to be exact in funding under FFPA to spend through federal fiscal year 2025. The next area of considerable discussion for every state and also within Texas are the foster care candidacies. Currently, Texas has as its 4E foster candidate a focus on children at imminent risk of foster care, and we have the ability to expand that definition under FFPSA. What you can see in the strategic plan is a proposal for consideration with our legislative partners to consider a slight expansion of that candidacy to include families in the FPSS stage of service, our current candidacy, but with an addition of families we're already working with, which are those families we're reunifying and families who have adopted a child and might benefit from post-adoption services, if those services will prevent the removal of that child for foster care. So it's the theory of change there being that evidence-based FFPSA service would stabilize the family and prevent a need for removal. And these changes will determine the eligible population, but a conversation is still taking place at the legislature. Pregnant and parenting foster youth are their own candidacy in FFPSA and are not a part of the imminent foster risk candidacy. Also, there was a lot of stakeholder input in considering the types of prevention services that could be funded for this proposed candidacy, and also the mechanism for that funding. You can see in the plan several options laid out for our legislative funders to consider, as they would need to provide the state match in order to draw down the 4E in the future. The first option laid out is the option of weighting and coupling the provision of FFPSA prevention services with the addition of FPSS in the community-based care model. So this sort of ties both FFPSA prevention services together with FPSS provided at the CDC level and would fund those prevention services through the SSCCs as part of community-based care. Another option, which could begin more quickly, would be for FPSS or CPS to have funding to purchase services in the model it does now, which is through open enrollment for needed mental health, substance abuse treatment, or parenting services. I think I'm reading this out of order. So per the provision of Senate Bill 355, DFPS explored the resources necessary to coordinate prevention services that exist now with CDC implementation. The coordination of FFPSA services in the catchment area is unrelated to FFPSA on the one hand, but could be coordinated if made eligible matching funds. Prevention service options and the QRTP pilot will be discussed in more detail in the next slide. I think this is the option I already mentioned, sorry you guys. So this is the coordination of FFPSA services and CDC, and then the FFPSA capacity I already mentioned. And then the third option is the coordination of FFPSA services to just study it as something we could do now in the short run with a long-term plan of financing it as a part of CDC. A fourth option is to pilot community-driven models of FFPSA, which look similar to maybe a PEI HOPES model, where a lead agency would propose any variety of services allowed under FFPSA in connection to community needs, but would be provided for in contracts separate from community-based care, perhaps in coordination at a later date. Another option is to expand the Helping Through Intervention and Prevention Services program, which already is serving pregnant and parenting foster youth, but to allow that provision statewide. And then the last model is to expand capacity for PEI's in-home parenting programs that are evidence-based and meet FFPSA criteria, but with reserve slots for candidate families. The last option in the plan is to pilot a rural service option for evidence-based services that would include the training of FFPSA caseworkers and chosen evidence-based parenting model, and would give the state a distinct idea of how service provision would look different in rural areas with rural service providers and the needs of those rural families.
The QRTP pilot, Qualified Residential Treatment Program pilot, there is a small subset of children and youth in care that have extraordinarily high needs, and they are the ones for whom a QRTP may be appropriate. The FPS will use the results of this pilot to help inform an appropriate rate to reflect the requirements in the QRTP. This would include an appropriate daily rate that included provider costs for maintaining the necessary medical staff, funding for provider accreditation costs, DFPS resources required to ensure federal reporting and placement requirements, including clinical administration staff to ensure appropriate placement, and associated training and IT costs for creating a new type of placement. The state could benefit from more information learned through this pilot and with minimal state investment, as federal funds could be used to complete this work. At the end of the pilot period, we would have the information necessary to make recommendations about the costs and the benefits of a full implementation throughout the state. The estimated timeline is listed here. We first will hire staff to project manage and oversee the QRTP pilot program. This is now through December 20th, 2020. Develop and release the RFA, design processes and protocols for QRTP pilot program, including independent assessment court requirements. This is January 2021 through January 2022. Post the RFA January to March 2022. Enter into contract or contracts for QRTP pilot program April 2022. QRTP DFPS court readiness work April to June of 2022. This option was already included in the intended FFPA expenditures in a request submitted to the governor and the Legislative Budget Board. DFPS anticipates a total cost of $8 million all funds.
So DFPS, along with HHSC and other community partners, have already begun to use federal fund grants to explore how best to serve this population. DFPS received Kinship Navigator grants authorized by FFPSA since its enactment in 2018, and it was awarded funding for 3 consecutive grant years. We've spent those funds in 3 different ways. A lot of enhancements to 211 to help families navigate to services through that mechanism. There has been funding for the evaluation of Kinship Navigator approaches. And lastly, we just awarded 4 grants to community-based providers to pilot service provision to kinship providers, both those involved and those not involved with the DFPS system. I think now is the time where we are going to read questions from the chat room and answer them. So, do we have any questions? Another option is you can always send questions even after this webinar to the email on your screen. We're checking right now for the chat room. We're not seeing anything, so give us a moment in case we're missing something. We are not seeing any questions in the chat room right now. Give a couple more minutes for folks to perhaps chat in a question, but otherwise, please email.
So there is one question: is the QRTP pilot fully paid for by federal funds? And the answer to that is yes. It's part of our FFPA plan. Another question has come in about how FFPSA will affect emergency shelters. And as mentioned on a previous slide, the first 2 weeks of a stay in congregate care qualifies for federal funding under FFPSA, as well as if children were in an emergency shelter prior to September of 2021, prior to September of 2021, their stay would also be covered through federal funds. But beyond those 2 weeks, or any placements that were grandfathered in prior to the implementation of FFPSA, those placements would no longer be allowed for federal claiming. It doesn't prohibit the agency from continuing to place in emergency shelters. It just impacts the way that we draw down our federal funds.
There's a question about whether any of the prevention services would change the nature of the current PEI prevention programs, and the answer is no, that there are distinctly different funding sources, and we see the work that PEI does now as being upstream from entry into child welfare and meant to be offered in the community to families who have not yet been involved in the system. And the only impact would be if any of the organizations providing those services were contracted to expand their service provision to add these families and this work to the continuum. Just digesting the comments and reading them as we go. So if there's several pilot programs, I think, proposed, and The question is, how do you apply to be a part of them? So just to be clear, these are all proposals for the legislature to consider. Nothing has been approved. We would have, the DFPS would still need to submit its plans to the federal government before we implement any of these. So these are all just for consideration. But once approved by both our legislature and the Administration for Children and Families, we would put out requests for application like we do for any other service provision, and we would send out broad notification through all the regular channels about those opportunities. But to be clear, there are no opportunities currently other than the Kinship Navigator pilot we already funded because those funds were already available to us. We're still reading, you guys. Sorry for the lag. But thank you for your questions. So one of the questions is, will there be any money available to start up programs or start agencies, or will it be mostly focused on programs or agencies already operating and or licensed? I think it depends. I don't think it's any different than any other opportunity we put out. If it's a brand new agency, it will depend on the criteria in the RFA about experience and readiness. So I don't think anything is ruled out, but there are just some practicalities of being ready to implement within a certain time frame that might lean more heavily towards programs that already have experience or infrastructure, but there's no hard line about that in any of these models.
The next question is, how do you apply to be part of the pilot program? And so, as mentioned on a previous slide, it's anticipated that we would release a request for application for a site to be a QRTP. And so we would be notifying stakeholders, much as we did for this webinar, if when that opportunity presents itself, when we release the request for application.
And so for the funding for all of these is different depending on the type of program, but most of this requires both an investment from our state legislature and then approval from our federal partners. So there is quite a ramp-up time before we make funds available to the public. So again, just a reminder, none of this funding is available now. None of these proposals have been approved or made final. We're just sharing our deliberations at this stage based on all the input we've already received and as directed by the legislature in the strategic plan that was due September 1. We have a question about would current PEI programs such as HIP and HOPE be replaced by these efforts? No, that is not the idea. As I've said, the prevention programs already funded would retain their purpose of serving families in earlier stages of crisis. The HOPE program is not a deliberate part of any of these proposals. It's more maybe just a model or a framework we borrowed from. But the HIP program and those providers providing HIP services, I don't think they will be replaced, but they will be required to come into compliance with FFPSA in terms of the evidence-based models they're choosing, and that might involve some additional data entry as well. But we don't anticipate a new procurement per se, more a expansion into areas we do not currently have the HIP program in. So there's a question, will FFPSA apply to anyone outside of foster care services that provide services to children in foster care? And I think the answer is it could, depending on the type of services made available and an opportunity to bid. So I think depending on what the legislature approves and we decide to fund, then we will decide the right applicant base for those RFAs. And they might be broad and inclusive. They might be excluded to certain types of organizations with certain experience. But I do think there's room for organizations that are serving families and children outside of child welfare to begin serving families under FFPSA. It will not be, depending on which of the many options we've presented, it will not be excluded to only those agencies currently serving foster care children and their families. Thanks for these questions. Okay, there's a question about there are no funds for Kinship Navigator at this time, and the answer is we just made available an opportunity for PEI's STAR program, or that we've just renamed to the Family and Youth Success Program, for those of you who do know that, to apply to add funds to their contracts to pilot a Kinship Navigator. So this is an example of funding opportunity that did go out to a narrow group of providers. Our PEI STAR program is already serving families in crisis and youth in crisis, and has services available in all 254 counties. So we made the opportunity to work specifically with kinship providers available to only that network as a way of expediting the ramp up of those services. And because they are already serving kin providers, about 17% of the families served in our STAR program are kin, grandparents, uncles. So that there is funding available that went out in that way and has already been awarded to 4 different providers. There is not new money available at this time.
The next question is, will these changes decrease the need for foster families? And as far as children in foster care services, it is the opposite, actually, in that it will increase the ability for the state to draw down. It won't increase the ability. Let me rephrase that. Foster family care will still be an eligible placement setting for us to draw down federal funding. I think the hope and the vision behind FFPSA is that an investment in prevention services could lead to fewer children coming into care, but that is, I think that's something that we would hope for down the road, depending on how FFPSA is implemented in the state of Texas. But it should not change the need currently or in the near future for foster families in the state.
And I would just add, I think that's sort of the flavor of the various options we've provided, is that we wanted to take the opportunity to pilot several different approaches and see what does seem to impact families' ability to stay together without the need for foster care intervention. And we know this is a state full of diverse types of families, diverse types of organizations, and that's why we have a diverse set of proposals, with the idea that there is a lot of evaluation down the road before Texas could ever scale up any one particular approach.
We've had 2 additional questions I'll try to answer. The first was, when do we anticipate the federal approval to come in? And just to reiterate, so Sasha was sharing that we are sharing with you our plans that have gone out through the strategic plan. We look forward to our legislative session, and we'll hear more about those options. Once we know those decisions, then we'll move forward and go through a process with our federal partners. It's quite a lengthy, I guess, process in which we will propose our populations and evaluation methods. So we still have a ways to go there, but I know we have a commitment to continuing to communicate with all our stakeholders through this process. The second question was more specific, and I think it was just someone wanting to assure that the child was in a setting, a 4E eligible setting on September 29, 2021. How long could they stay eligible for 4E in that setting? And our understanding of federal regulation is that they will be 4E allowable as long as they stay in that original that as long as the child has a need for that setting, CPS will be working to keep the child stably in their setting. So we're changing the funding stream, but any setting change would be responsive to what the child's needs are.
The next question is, are the accreditation standards and accreditation process for QRTPs available yet? And so the FFPSA outlines 3 accrediting bodies that would be accepted for QRTP. It is CARS, COA, and JCO. And then if the state, which is not part of our strategic plan at this time, a state could propose an accreditation process to the federal government. That is not part of the Texas plan at this time, but COA, JCO, and CARS are outlined in FFPSA as accrediting bodies appropriate for QRTP.
We're mining through the questions. Okay, I'm going to read this question. Do you anticipate phase, that's the former PEI program STAR, programming, so do you anticipate that programming relating to or interacting with any of the proposals that the legislature will be evaluating? So I think any organization that is currently working with DFPS on any of its continuum of work, whether it's prevention services, whether it's foster care services, all those organizations probably have reason to apply for a variety of these models. But I don't think, other than the Kinship Navigator program and the HIP program, I don't anticipate we'll be working directly with those models or with those PEI programs, but rather they would just be eligible to apply for a grant or a contract like they would now. But certainly, you know, organizations that are working with children and families in all of these capacities all have something to bring to the table. And we're going to take a few more questions, and then the rest that we can't get to, we're going to consolidate, and some of them are starting to have repetitive themes, and we will put them in an FAQ section as a follow-up to this webinar. So we'll just take a few more, or just give us a minute because we're just reading through them to determine what's a new question we haven't yet answered. Okay, it seems like the only remaining questions are also all again about when and how and for whom the money funds will become available. And so we will put all of these questions online under an under a frequently asked questions headline and send out a link to everyone who was registered for this webinar. And we appreciate your questions. And just to kind of repeat a few themes, the strategic plan is really our agency's proposal for the legislature to consider, and nothing has yet been finalized. And the next steps would be the submission of our plan to the federal government. We also need their approval. So we are just being transparent and sharing with you our current thoughts about potential ways in which FFPSA could be implemented in Texas. And any availability of funds will be made through the usual procurement channels. So make sure you're signed up for all the GovDoc options, which we'll put again in the frequently asked questions to make sure, so you'll know when there are opportunities for funding made available. But I think our biggest request, as we've talked about FFPSA over the last couple of years, has been have these conversations in your community with families, get that experience of Live Voice, talk to your Child Protective Services colleagues, and be thinking boldly and innovatively about how to better serve children and families and how to do it in partnership with the agency and with all the different service providers in your community. So, you know, certainly you'll want to wait and see what the agency can make available through funding, but don't wait just to see what we want. Think visionary about what you think families in your community need, and be ready when those grant opportunities become available. And we appreciate your time and attention and partnership. This plan was made with a lot of input from lots of different folks over, and I'm sure many of you on the call over the last months and years. So we appreciate the partnership and look forward to sharing more when there is more to share. Have a great Tuesday.